Hello everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. Let's start the fourth session of female reproductive system, which consists anatomy of vagina. Here's the outline of today's video. The vagina is the female organ for copulation and forms the lowest part of birth canal. The term vagina means a sheath. Vagina extends from vestibule to cervix. In the erect posture, the vagina is directed upwards and backwards. The long axis of uterus and cervix forms an angle of 90 degree with long axis of vagina. The anterior wall of vagina is about 8 cm long and the posterior wall about 10 cm long. The diameter of the vagina gradually increases from below upwards. The upper end is roughly 5 cm, twice the size of the lower end, which is 2.5 cm. Next, coming to the presenting parts. The anterior wall is entirely non-peritoneal and in the upper part is related to bladder. In the lower part, urethra is embedded in the anterior wall and the posterior wall is covered with peritoneum in its upper part, and from above downwards the posterior wall is related to sigmoid colon, rectum and anal canal. Lateral walls are related to McEnroth's ligament, ureter, uterine artery, bulb of the vestibule, greater vestibular glands. Next, coming to the structure of vagina. From outside inwards, it presents the following coats: serous coat, facial coat, muscular coat and mucous coat. First is serous coat. It is derived from peritoneum. Then the facial coat is derived from endopelvic fascia. The muscular coat consists of outer longitudinal and inner circular layer, and the mucous membrane is lined by non-keratinized stratified squamous epithelium. Next, coming to the hymen. Hymen is an incomplete mucous fold which is situated close to the external orifice of vagina. And during coitus, the margin of the hymen becomes fissured, producing tags of mucous membrane, the caruncle. So, when the hymen is no longer intact, these small rounded elevations are what remain, and this is known as caruncle. Stretching or turning of hymen affected by various factors including sexual activity, tampon use or pelvic examination, excessive exercise. Next, coming to the fornices of vagina. The interior of the upper end of the vagina is in the form of a circular groove that surrounds the protruding cervix. The groove is divided into 4 parts called the vaginal fornices. The anterior fornix lies in front of the cervix and is the shallowest. The posterior fornix lies behind the cervix and the deepest, and the lateral fornices lay one on each side of cervix. Next, coming to the blood supply. The vagina is supplied by uterine artery, vaginal artery, internal pudendal artery and middle rectal artery. And the veins corresponds the arteries and drain into internal iliac vein. Lymphatic drainage of vagina. From the upper third, drain into internal iliac and external iliac lymph nodes. From the middle third, drain into internal iliac nodes, and from the lower third, drain into the superficial inguinal lymph nodes. Next, coming to the nerve supply. The lower 1/3 of the vagina is pain sensitive and is supplied by the pudendal nerve. And the upper 2/3 of the vagina are pain insensitive and are supplied by sympathetic lumbar 1 and 2 and parasympathetic segments sacral 2nd to sacral 4. The next part of this topic will coming soon. If this content is useful for you, then please put a like and share it with others. And for getting more videos like this, you can subscribe my YouTube channel NG's Corner for nurses. And for any suggestions or for any queries, you are most welcome to comment. Thank you for watching.